Clinical trials should be the standard of care. We are not giving up on standard of care. We're merely trying to develop something that's better than what we know already works. My name is Rebecca Arend, and I'm the Associate Director for Clinical Research in the O'Neill Comprehensive Cancer Center. Clinical trials offer our patients access to treatments years before they might be FDA approved. And the reason why we're doing it is because we think that what we're giving you is actually better than the standard of care. We've actually seen many people who are surviving today that otherwise would not be alive if they did not have the opportunity to enroll in one of our clinical trials. What we say is that every single drug that a patient gets from a community oncologist or a patient gets in my office if there's no clinical trial started on a clinical trial. That whole process takes about 10 years. From drug development to phase 1 to phase 2 to phase 3 to FDA approval. So at any given time, we usually have about 200 trials open to offer to all types of patients with cancer. We are here as a resource for all general oncologists across the state of Alabama. It does not mean just because we're an NCI Comprehensive Cancer Center that you have to come to UAB to get your care. But the reality is that we can help tailor the treatment plan. If you're somebody who enrolls in a clinical trial, yes, that absolutely could potentially benefit you most of the time. There are some drugs that even if you as a patient don't get the benefit that we hoped for, that information is important for all other cancer patients and future cancer patients because it helps us determine what the right dose is, what the appropriate treatment is, and what should be the standard of care. So I think one of the misconceptions of clinical trials is that the trial is a last resort, or the trial is a last-ditch effort, or a trial is when you've exhausted all other options. But in reality, we're always at least giving you what we know is the standard of care. If you're eligible and there's one that is for you, then there's no reason not to try that clinical trial. And the idea is that we are not giving up on standard of care. We're merely trying to develop something that's better than what we know already works. An investigator, and sometimes we use the word a principal investigator, is someone who runs the trial. Now, you can have a principal investigator who is responsible for a trial here at UAB, but the trial was designed somewhere else. The local investigator is the person who's responsible for the overall conduct of that trial. They're responsible for making sure that the correct dose is given to the correct patient at the correct cadence, and ultimately responsible for publishing the data. That's also equally important, even if it's a negative trial. ClinicalTrials.gov is the clinical trials website that if you were to type in your type of cancer, it tells you all the clinical trials in that cancer type and the location of where they are. Empowering patients to ask their physicians, to say, are you aware of any clinical trials for my cancer type? And if not, is there some place that you can refer me so that I can ask that question? It's a bi-directional communication that's happening both from the community and the physicians, and that we are intermingling and asking each other these questions. I think the most important thing to know about cancer clinical trials is that they should be the standard of care. And your doctor, no matter where you are, should discuss clinical trials and talk about that as an option for every single patient who has cancer. Whether or not a trial is an option or not, it should be a part of the discussion.